In this video by deckplate, we will understand the VA rating for infectious diseases: Beriberi, pellagra, brucellosis, rickettsial, melioidosis, Lyme disease, parasitic disease, hyperinfection syndrome, schistosomiasis, hemorrhagic fevers, campylobacter jejuni infection, coxiella burnetii, lupus, erythematosus. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. If you're a veteran dealing with infectious diseases, understanding how the VA rates these conditions is key to receiving the benefits you deserve. The VA has specific diagnostic codes and rating criteria for a variety of infectious diseases. General rating formula for infectious diseases for active disease. Rating 100%. After active disease has resolved, rate at 0% for infection. Rate any residual disability of infection within the appropriate body system. Beriberi. Diagnostic code 6314. Beriberi is a condition caused by a deficiency of vitamin B1 thiamine. The VA rating for beriberi depends on the severity of symptoms. 100% rating, with congestive heart failure, anasarca, severe generalized edema, or Wernicke-Korsakoff syndrome. 60% rating, with cardiomegaly, enlarged heart, or peripheral neuropathy with foot drop or muscle atrophy. 30% rating, with peripheral neuropathy characterized by absent knee or ankle jerks, loss of sensation, or symptoms such as weakness, fatigue, anorexia, dizziness, heaviness in legs, headache, or sleep disturbances. Residuals are rated under the appropriate body system once the active disease has resolved. Pellagra, diagnostic code 6315. Pellagra is a disease caused by niacin vitamin B3 deficiency. 100% rating, with marked mental changes, moist dermatitis, inability to retain adequate nourishment, exhaustion, and cachexia. 60% rating, with all the symptoms plus mental symptoms and impaired bodily vigor. 40% rating with stomatitis, diarrhea, and symmetrical dermatitis. 20% rating with stomatitis, achlorhydria, lack of stomach acid, or diarrhea. 10% rating with confirmed diagnosis and nonspecific symptoms like decreased appetite, weight loss, abdominal discomfort, weakness, inability to concentrate, and irritability. Brucellosis. Diagnostic code 6316. Brucellosis is a bacterial infection that can affect various organs. The VA evaluates it under the general rating formula for infectious diseases. The diagnosis and recurrence of active infection must be confirmed by culture or serologic testing. Residual disabilities affecting organs such as the liver, spleen, and musculoskeletal system are rated under the appropriate body system. Rickettsial, Ehrlichia, and anaplasma infections. Diagnostic code 6317. These infections are caused by bacteria transmitted by ticks, fleas, or lice. The VA evaluates them under the general rating formula. Residual disabilities, including conditions affecting bone marrow, spleen, central nervous system, and skin, are rated under the appropriate body system. This code includes infections like scrub typhus, Rocky Mountain spotted fever, and ehrlichiosis. Melioidosis. Diagnostic code 6318. Melioidosis is an infectious disease caused by bacteria found in contaminated water and soil. The VA evaluates it under the general rating formula. The initial diagnosis and any relapse must be confirmed by culture or other specific diagnostic laboratory tests. Residual disabilities such as arthritis, lung lesions, or meningitis are rated under the appropriate body system. Lyme disease. Diagnostic code 6319. Lyme disease is a tick-borne illness that can cause a range of symptoms. The VA evaluates it under the general rating formula. Residual disabilities, such as arthritis, Bell's palsy, radiculopathy, ocular or cognitive dysfunction, are rated according to the affected body system. Parasitic diseases not otherwise specified. Diagnostic code 6320. The VA evaluates these conditions under the general rating formula. Residual disabilities are rated according to the appropriate body system. Hyperinfection syndrome or disseminated strongyloidiasis. Diagnostic code 6325. This condition is caused by a parasitic infection leading to severe, widespread symptoms. 100% rating during active disease. A 100% rating continues throughout active disease, followed by a mandatory VA examination post-treatment. Residual disabilities are rated under the appropriate body system. Schistosomiasis. Diagnostic code 6326. Schistosomiasis is a parasitic infection caused by flatworms. 0% rating as an acute or asymptomatic chronic disease. Residual disabilities, including conditions affecting the liver, intestines, female genital tract, genitourinary tract, or central nervous system, are rated under the appropriate body system. Hemorrhagic fevers. Diagnostic code 6329. Hemorrhagic fevers, such as dengue and yellow fever, are severe viral infections. The VA evaluates these under the general rating formula. Residual disabilities, including conditions affecting the central nervous system, liver, or kidneys, are rated under the appropriate body system. Campylobacter jejuni infection. Diagnostic code 6330. This bacterial infection commonly causes gastroenteritis. The VA evaluates it under the general rating formula. Residuals, such as Guillain-Barré syndrome, reactive arthritis, or uveitis, are rated under the appropriate body system. Coxiella burnetii infection, Q fever, diagnostic code 6331. Q fever is caused by the bacterium Coxiella burnetii and can affect various organs. The VA evaluates it under the general rating formula. Residuals, such as chronic hepatitis, endocarditis, osteomyelitis, chronic fatigue syndrome, or vascular infections, are rated under the appropriate body system. Non-typhoid salmonella infections. Diagnostic code 6333. Non-typhoid salmonella typically causes gastrointestinal symptoms. The VA evaluates it under the general rating formula. Residuals like reactive arthritis are rated under the appropriate body system. Shigella infections. Diagnostic code 6334. Shigella infections can cause severe gastrointestinal symptoms. The VA evaluates it under the general rating formula. Residuals, including hemolytic uremic syndrome or reactive arthritis, are rated under the appropriate body system. West Nile virus infection. Diagnostic code 6335. West Nile virus is a mosquito-borne illness that can cause neurological issues. The VA evaluates it under the general rating formula. Residual disabilities, such as physical, functional, or cognitive disabilities, are rated under the appropriate body system. Lupus erythematosus. Systemic diagnostic code 6350. Systemic lupus erythematosus is an autoimmune disease that can affect multiple organs. 100% rating for acute lupus with frequent exacerbations, producing severe impairment of health. 60% rating for exacerbations lasting a week or more, occurring 2 or 3 times per year. 10% rating for exacerbations occurring once or twice a year or if symptomatic in the past 2 years. This condition is rated either by combining evaluations for residuals under the appropriate system or by using diagnostic code 6350, whichever results in a higher evaluation. Thank you for watching this video. Please don't forget to subscribe and like our videos.